We're going to talk about a topic now that actually made news about a week or so ago. And this is when Quebec and Jean Boulet, the CAQ Labour Minister, along with Christian Dubé, the Health Minister, announced something different, something new that, interestingly enough, even the opposition thinks is a good idea, at least in theory. Let's find out more. Jean Boulet, the CAQ Labour Minister, is on the line. Minister Boulet, thanks so much for your time this afternoon.
Thank you. It's a pleasure.
So this is a bill that, in essence, would prohibit insurance companies from demanding notes, medical notes from doctors, which would, and I say the word in theory, free up doctors from unnecessary paperwork, which they have been complaining about in Quebec for the longest time. This is not unique to your government. My question is, despite what I said about the opposition thinking this is a good idea, and I think uniformly they did, when we read and hear from doctors, this idea that it's going to free up, and I think the announcement originally was it'll free up 500,000 additional medical appointments for patients every year. That's a problem as far as the doctors we have talked to saying that's just pie in the sky. It's never going to happen. What's your reaction to that?
Of course, Aaron, it's an estimation, but we have to improve the access for patients in Quebec, and I think those many prescriptions are unnecessary, and we want to allow the physicians to determine by themselves the frequency and the relevancy of the real appointments. So it will free up approximately 500,000 potential appointments. Again, it's not a precise calculation. It's not necessarily mathematical, but at least it will improve the access, and very often it's unnecessary. If you want to consult a physiotherapist, for example, an occupational therapist or a psychologist, in order to have your reimbursement, if you have to get a prescription from a physician, very often it's not useful, and I think we have to cut through this paperwork. And it's exactly the same approach for when you have to purchase a technical device like a cane, crutches, or an orthosis. You don't necessarily have to go see a physician. So it's the time they will have available for the patients in Quebec, improving the care, the quality, and the access. And I think it's really fundamental.
So you say it's a theoretical number, 500,000. It sounds like an awful lot, doctors, as I said, suggesting it's not going to be perhaps that high. But regardless, as I said, it is a good initiative. I think most people agree with that.
Yeah, of course. And the calculation is based upon the fact that 4 million Quebecers have access to a private insurance. 90% of them do not require automatic appointments. So if you take the 10% of those 4 million at a rate of one appointment per year, it represents more than 400,000 appointments that will be freed up. So it's an approximation, but close to the reality.
So let me go to the other point that some people have brought up as well. As I said, initiative sounds good, makes sense. And if we leave numbers aside, actual numbers aside, part of the issue here, people are saying, well, this is all well and good, but now what's going to happen is it's quite likely that insurance companies will increase premiums based on this. What do you say to that?
I say that, of course, insurers will have to make their own evaluation of the risk that it can represent. It can have, I'm not naive, it can have a certain impact, but not significant on the amount of the premiums. But of course, I will let them do their calculation and decide what's the relevant premium according to the new circumstances. But I think it's much more preponderant to improve again the access for Quebec patients to a better service, and to reduce the delay and to reduce the administrative burden so many physicians have to comply with.
I would ask as well, and I don't know this is part of what you plan to do, will there be an opportunity to sit down with these companies, or is this just going to be introduced as a bill, and obviously it seems it would pass rather easily?
Of course, it is an opportunity. We have spoken with the medical practitioners, the general practitioners, and we will be talking with the insurers. We want to consult all the relevant partners and make sure that it answers the needs we have in Quebec to improve again the medical access and to increase the number of medical appointments that will be freed up.
I would ask you as well as labor minister, and this is a bit of an odd sort of situation, right? Because typically this is something we would talk with Christian Dubé about. He's the health minister, you're the labor minister, but yes, this does affect labor. What about this story the other day about just how swollen Quebec's healthcare system is in terms of labor? How many people have been added? I think the number was 4,500 people just by this government. Have we gone too far? And if we have, and it hasn't made a difference in healthcare delivery, what do we do about it?
It's what my colleague has been doing with the creation of Santé Québec. His main purpose and his main goal is to improve the efficiency of the system. It's a system that's very often too complicated. The delays are extremely long and the access is not as easy as it should be. So we've been working in order to improve the situation and make the system, even if it's complex, be more efficient for the future, and it's been going in the right direction as of today.
Okay, I would ask you one other thing as labor minister, and this is something that's been talked about: temporary foreign workers, etc. Are you hearing still that employers across Quebec are having trouble finding labor?
Of course, there's a labor shortage that will we will have to face this shortage for the years to come, and we have to improve the productivity of the companies. We have to make the door open to people coming from the labor market. I'm talking about the handicapped people, the Aboriginal people, the foreign temporary workers as well, particularly in the neuralgic sectors in many regions. We need more people in order to allow the companies to keep operating. So it's essential. It's a challenge, and we've been working on that to improve on many fronts, Aaron.
But if it's the challenge, and I understand that, then how do you square the circle of the government saying, we're taking in too many of these workers, yet at the same time we need workers and we need more workers? How do you fix that?
We also have to think about the capacity of Quebec to include people coming from other countries. It's a question of capacity in the health, social services sectors, and of course the shelters. We have to make sure that there's a compatibility between the number of the people who come to Quebec and the social services and the health services we can provide for their attention. I think, again, I reiterate the importance of welcoming them, but always in compliance or in respect with our capacity in Quebec. I think it's an equation that has to be taken into consideration.
All right. Minister, I thank you so much for your time. Very much appreciate it.
Thank you very much, Aaron, and talk to you soon.